If you are having neck or back surgery soon, this video will help you prepare for that. Hi, my name is Dr. Antonio Webb. I'm an orthopedic spine surgeon located in San Antonio, Texas. Well, surgery, especially spine surgery, very big deal. This can be a very frightening time for a lot of people. It can make people nervous because a lot of things can happen in the preoperative period, which means before surgery, during surgery, and also after surgery. Well, this video is intended to help you and guide you through that process. If you are my patient, this video is essentially to guide you to be able to answer some of those questions that you may have before our surgery. So we're about 30 days or more outside of surgery. Here are some things that you need to know and should be doing. The first thing you should be doing is staying active. And I know that's very hard to do if you're in pain and we're going to surgery because of that pain. Well, before surgery, I think it's important to stay active as best as you can. There's an old adage that says motion is lotion. And also, if you don't use it, you'll lose it. So a lot of the muscles that we need to help you get through the recovery process and through the surgical process, we have to use them. So sometimes we'll send patients to the physical therapy before surgery to actually strengthen those muscles, which will help them in the recovery process. The second thing you need to know, 30 or more days outside of surgery, is that you should drink plenty of protein and drink plenty of fluids, and also eat plenty of fruits and vegetables. Wound healing can be a major problem in spine surgery, and it takes, in general, between 2 to 3 weeks before the wounds close. You have to protect it during this time, and your nutritional status has to be up to par. So lots of protein, lots of fruits and vegetables, and make sure you stay hydrated. The other thing that you should know if you're more than 30 days outside of surgery is that this is typically the time that we get clearances. If you have any heart issues, lung problems, kidney problems, you need to go see those specialists so that they can clear you for surgery. And that's called a clearance, whether that's a cardiac clearance or a pulmonary clearance, a hematology clearance if you're on blood thinners. This is the time where we get these clearances and we see your specialists so that they can write a letter or approve you, give the blessing to move forward with surgery. For most surgeries that we do, blood work is required. This is usually blood that is taken to test your bleeding levels, look at your kidney function, look at your liver enzymes. Well, this blood work is only good for 30 days. So if we get the blood work too soon, we'll unfortunately have to repeat it. So I wouldn't recommend that you get any blood work until we have a surgical date. If we have a surgical date and it's within the 30 days, then it's okay to get your blood work. If you get it too soon, we'll have to repeat it. You don't have to fast for this blood work. This blood work is intended to make sure that we're doing surgery in a very safe and efficient manner. So you're 1 to 2 weeks outside of surgery. What should you know? A lot of the medications that you may be taking may increase your risk of bleeding during surgery. And this is very important in a lot of surgeries, especially spine surgery, where we're working around the spinal cord and nerves. A lot of the medications that you take, such as your pain medications, anti-inflammatories, Motrin, Advil, naproxen, Aleve, these medications need to be stopped 7 to 10 days before surgery. So if you're taking meloxicam, which is Mobic, if you're taking ibuprofen, which is Motrin, if you're taking Advil, naproxen, Celebrex, any of the anti-inflammatories, which we call non-steroidal anti-inflammatory drugs or NSAIDs, well, these medications need to be stopped 7 to 10 days before surgery. If you do not stop these medications, you run the risk of your surgery being canceled. Any blood thinners that you're taking as well need to be stopped. And these blood thinners can range from Coumadin, which is warfarin, Plavix, Eliquis, any of Lovenox, any of the blood thinning medications that you may be taking for your heart or for a history of blood clots. Well, it's important to talk to your physician to get a timing of when you should stop this medication and also when you'll be restarting the medication after surgery. So anti-inflammatories, Motrin, Advil, naproxen, Aleve, Celebrex, 7 to 10 days before surgery, we must stop those medications, as well as your blood thinners. And each blood thinner is a little bit different, but in general, most blood thinners, such as aspirin, should be stopped anywhere between 7 to 10 days before surgery. The next thing you should know and make sure you stop before surgery are supplements. These supplements can increase your risk of bleeding as well. Ginkgo, ginger, fish oil, vitamin E, these medications can increase your risk of bleeding, especially a lot of the herbal medications. The sooner that you stop these supplements, the sooner that they will get out of your system. So if you're taking ginger, ginkgo, garlic, vitamin E, fish oil, these are supplements that need to be stopped before surgery. Other things that you'll get for the preoperative clearance and also your preoperative workup in this time frame is a chest x-ray and an EKG if you're over the age of 50 or if you have any history of heart or lung problems. This chest x-ray is usually good for 6 months. The EKG is usually good for 3 months if there are no abnormalities noted. If we find anything that's abnormal on your EKG, such as an abnormal heart rhythm, or your chest x-ray, then we'll have to unfortunately send you to either a heart doctor, which is a cardiologist, or a lung doctor, such as a pulmonologist, to make sure that you're safe for surgery. All right, so now we're a couple days outside of surgery. What should you be doing? Obviously, doing some of the same things as we discussed, staying active, making sure that you're stopping all of your anti-inflammatories, make sure that you're stopping all of your blood thinners. You should be off of them by this time. During this time, it's important to not only go to the hospital and just make sure that the day of surgery, you know exactly where to go, and also register. At the hospital, there's forms that can be emailed to you, that can be signed electronically, that will minimize the time that is spent the morning of surgery. All right, so we're the night before surgery. Here's what you should know. This is a very nerve-wracking and nervous time for a lot of people, and I certainly understand that. My job is to make sure that you get through surgery in a very safe and efficient manner. The night before surgery, it's important to know not to eat or drink anything past midnight. If you eat or drink anything, if you have food or water or coffee, the morning of surgery, your surgery will be canceled. So nothing to eat past midnight, the night before surgery. Make sure you get a good night's sleep. You'll be sleeping during surgery, but certainly understand that the morning of surgery, there's a lot of things going on. You want to make sure that you wake up the day of surgery and you're not rushing. You know exactly where to go, what time to be there, and also what things to bring. All right, so we're at the day of surgery. Here's what you should know. It's important to arrive early. Make sure that you have the route kind of planned out in terms of which road that you're going to take, which exits, what time you're going to leave the house, and what time you're going to make it to the hospital. In general, most patients get to the hospital anywhere between 2 to 3 hours before their planned surgery. So if your surgery is planned at 9 a.m., most people will get to the hospital between 6 to 7 a.m. to make sure that your IVs started, all of your medications are checked, that your paperwork is filled out, and you have time to meet with me before surgery. Before surgery, I will meet with you in the preoperative holding area. I'll make sure that we address any remaining questions or concerns, and I'll outline exactly what my plan is for your surgery. This is also where you'll meet the neuromonitoring technician. During surgery, your brain and also your spinal cord, as well as your nerves, are monitored. We do this by placing multiple wires over your head, your arms, your feet, and there's a neurologist that watches the whole surgery. You'll meet the neuromonitoring technician the morning of surgery. They'll connect you to multiple wires. And in surgery, I constantly communicate with the neuromonitoring technician who's in the operating room and also the neurologist who watches the whole thing remotely. This ensures that your spine operation is carried out in a very safe manner. You'll also meet the operating room nurse. You'll meet my nurse practitioner who assists me during surgery. You'll meet the anesthesiologist who will give you medication to help you relax while going back to the operating room. So, this is a video that is intended for people that are undergoing spine surgery. If you're more than 30 days outside of surgery, it's important to stay active. Make sure that you drink plenty of fluids, stay hydrated, lots of protein and lots of fruits and vegetables that helps with wound healing. If you're 7 to 14 days outside of surgery, it's important to make sure that you stop any anti-inflammatories. This is Motrin, ibuprofen, meloxicam or Mobic, Celebrex, naproxen, Advil, Aleve. Any anti-inflammatories that you're taking must be stopped 7 to 10 days before any spine operation. If you're taking blood thinners, it's important to talk to your treating physician and come up with a plan of when those blood thinners will be stopped before surgery and also after surgery restarted. The night before surgery, it's important to make sure you don't eat anything past midnight. You have to have at least 8 hours of no food or drinking in your system. The only medications that you'll take the day of surgery are in general heart medications and blood pressure medications. Every other medication you'll stop. This is Dr. Antonio Webb. Thank you for watching. I hope this video helps you understand what to expect before your big surgery.